Hello, and welcome to the FlowRy Show, a journey through life's tapestry, wisdom for every generation. On this show, we talk about where generations intertwine, sharing stories, insights, and dreams. Whether you're a seasoned sage or a curious young mind, we are all students of the grand classroom of life. Join my co host Mike Ryan and I, Nicole Flowers, as we explore a tapestry woven with threads of collaboration, dreams, lessons learned along the way. For today's Flory Show, we have a very special guest, a visionary healthcare leader. I'll turn it over to my co host, Mike, to introduce this special guest. Mike?
Thank you, Nicole. It's always a pleasure to explore talking to new people. And some people I've known, and some people I've met for the first time on the podcast. But I must confess that I've known Baljeet for a number of years. And there's always a saying that I use often is that people recognize talent. And I recognize the talent that Baljeet, and he'll be humble, but I recognize the talent that he has as a leader. When I believe he was still at Berkeley, getting his master's in public health, which is a pretty nice, good school there. And so I had exposure to him. I was the founding board member of the American College of Healthcare Executives local affiliate, which includes, I think, about 53 different counties in California, called the California Association of Healthcare Leaders. And during that time, Baljeet showed up, spoke up, and gave good input to different board decisions of what we were doing. It was great having him early on in the beginning of that organization that I think eventually he ended up leading as well as serving on, I believe, the national board of the American College Healthcare Executives Board of Governors. So he's really local in San Francisco, and now he's in Dublin, California, across the bay. But I've been impressed with Baljeet in a few things. One is that his progressive leadership that he's been able to take at Zuckerberg San Francisco Medical Center here in the city, which is a very challenging environment serving the public. And then ultimately serving as a chief operating officer and strategy officer for that until recently. But his roots, I believe, go back to the pain and rehabilitation organization that he started and that he joined in 2006, I believe, was it an intern, Baljeet? And now you're CEO. And so, that to me talks a lot about his energy, his leadership, and never forgetting his roots of where he came from. For with that, I'll turn it back to you, Nicole, to kind of, as we explore kind of Baljeet's a magical career that he's had with a lot of hard work.
And Baljeet, we want to thank you for being on the show today as we explore, to Mike's point, your remarkable career and your impactful leadership during critical times, which we'll talk about, as well as your insights on the future of healthcare. And if I may, I just want to really dig in for our viewers, your strong background and the progression that you have made in your career. Mike alluded to from starting as an intern, and today you are a CEO for a private healthcare provider. I must also add that each of your roles, from the time you were an intern at the Department of Public Health, then the Director of Volunteer Services, you also were the Chief Experience Officer at the Zuckerberg San Francisco General Hospital, and today you're a CEO, that each of these roles you have built upon your previous experience to create a solid foundation for your healthcare leadership excellence. Why don't you share with us, Baljeet, what inspired your healthcare career path, and how has your vision evolved over the years?
Yeah, well, incredible. I think that is the the most incredible intro I've ever received. Like, everyone needs a hype team. I think you are definitely mine. You make me sound cooler than I am. So I hope the trailer you provided actually lives up to the movie or the show we're about to watch here with us. But
You earned it. You earned it.
yeah, I would say that, my thanks for the question, Nicole, just around, what inspired my healthcare vision and how it's evolved over time. One of those things that is very intimidating as you're growing into yourself from a child to an adolescent to, as being a teenager, then to an adult, young adult, is you're asked kind of questions around what's your vision, what do you want to do, and it's almost terrifying because you hear people have these visions and these very succinct or pithy, mission statements and ideas for themselves or what they want to do, and they're like, man, I have nothing like that, or what I'm about to say isn't polished. It sounds like gibberish. And so you want to say something that's so impactful and so profound when you are asked this type of question. And then, when I realized as I'm moving on in my career and becoming more of an adult, and eventually who I want to be when I grow up, is, you just gotta say what's in your heart, what's in your feeling, what do you want to do, and I think, and beyond that, then the other synonyms or multisyllabic words that can make it sound all fancy, can get in. But I think what inspired my healthcare vision was just, a desire to help people, but also first generation born here. My parents immigrated from North India, Punjab, to the United States. Father came in at the mid to late 70s. I was born. My mom shortly thereafter. I was born in the early 80s in New Orleans, Louisiana. And one of those things was that also what is a field that I can choose that would also bring some stability in life, right? From a blue collar immigrant experience, trying to hustle and grind to come up and make a living for your family in a country that is ripe for opportunity, but also, you have to, it costs money to live here. You have to have a house over your head. So dealing with food insecurity, housing insecurity, travel insecurity, all the insecurities. And so I think for me, what shaped my healthcare vision is, what can I do where I can have a stable enough life to provide for my family, to provide for myself, my family, and others. And so that kind of public health, social determinants of health, generational wealth component was coming in. And these are definitely words I learned recently, not as a 9-year-old in New Orleans, but, so that was one. And then as you're getting older, you're like, well, what can I do with my career? And I'm sure many of you, your guests, your listeners, yourselves have encountered that, when you didn't really know much, those big careers that seemed like they were great, lawyers, engineers, doctors, like, do one of those. That seems to be working well. People are making a living and they seem just fine. And so I leaned into healthcare. So I thought that was something that felt like it'd be cool to meet people and improve someone's, someone who's in pain. And that's kind of what catalyzed me down that path. And I think my focus and my vision on how it's evolved over the years, I think as I go through each interaction and I've failed forward multiple times in my life, I think that's an important thing. I want to always present very accurately and very genuinely about that. There are a lot of failures. I mean, again, I appreciate the glowing and warm description of my career. Those places and those roles certainly happened, but we don't have enough time in the day for us to go through each 365 day a year time in those roles and those nights where I was like, I don't know what I'm doing, or I think I just actually did something that was not the right way to have done this. And so, we can't really live always failing forward. But I think, Nicole, that's really helped inform my opinion around, like, what do the people we're trying to serve want? Like, what do the people we're trying to help actually want? And how can I don't have to worry about now having the best idea. I just got to listen to theirs. And then I just take their ideas and have them partner and say, how can we make this idea come to fruition? And I think that's really what's really influenced and informed my own thinking, where the hardest part for me coming out of school was, shoot, I'm new. I don't know the answers to any of this stuff. Like, I don't have any great idea on how to solve, the long length of stay. I don't have an idea of how to figure out how to improve access. I just barely figured out where the bathroom is in this new building I'm now employed in. So I don't know any of the other stuff. But that's where you're like, well, but other people know what they want, what they need. And now our role and my role will be crafting a path to figure out how to get there. And I think that is the was where I found my sweet spot. So hope that helps. Just kind of, that's how my vision came to figure out to be in healthcare, and then how it's continued to evolve over the years.
Yeah, I'll just jump in. One thing that you two have in common are immigration, and my wife's an immigrant as well. And it's been proven over and over again that immigrants have a certain desire, passion to, be successful, obviously, but also to help others, to understand the vulnerabilities that you have as a person, as a community, as you go through this world that's in the United States. And so I think it's kind of remarkable that you were, I guess I didn't even know you were from New Orleans, but because I lived a decade in New Orleans, but that's another subject matter that we will talk about sometime. But yeah, I think that, it's quite extraordinary that you were, by your both of you in this case, both of you, by your academics and your brains and your drive and your desire, were able to reach, the highest positions. And yeah, we stumble along the way, and we don't make all, mistakes do happen. But it's the key is not that you fail, is that you learn from your failures and you get back up. And so I know that Nicole has gone through, and we've had this conversation with her as well. But I think it's also interesting to see, as part of our topic is multi-generational, and I'm a baby boomer, so I get it. Hey, boomer. I believe you're probably a millennial, Baljeet, and same. And so I think that, some of the things that you've seen as you escalate or, gone up through the ranks of the organization, when you're at Alameda Health System, when you're at, I think, Laguna Honda, and when you're at the Zuckerberg Medical Center and others, working with the different generations that are, now Z, now that are, XYZ and boomers that were, now most of us are probably retiring. I'm not retiring, but, you've dealt with a full spectrum of generations. If you can touch upon that, any thoughts you have on that.
Also, it's one of those topics that when you're in a multi-generational workforce, it's hard. It is hard I think it's hard for everyone, no matter whether you are an individual who is being supervised by someone who is either, your peer, older than you, or even younger than you. That's something to navigate. If you're a person supervising someone who is younger than you, older than you, the same age as you, I think it's challenging. The traditional model, which is now is a bit more antiquated, is the idea of your boss will always be older than you and have known more, and and that's how it is. That's not the case anymore, right? And so one of the interesting parts for me, and I've had this challenge a lot in my career, is how to be able to confer with an individual who's your peer, right? So now you might have some type of power dynamic or hierarchy there, whether you're a formalized supervisor or you're a person who's been in the field or in the organization longer than that person has. So as a peer, and even if they're younger than you, if they're older than you, it's hard, because then it almost feels weird. Like I grew up in saying yes sir, yes ma'am to folks that are older than me, or just as a matter of being polite and etiquette. Growing up in the South, also you're just used to being a little bit more deferential to those who have wisdom, have come before you. So I think the way that it's to navigate is, one, overall, no matter what our question might be and the content will be here in our time together today, the Byzantine ideas of leadership kind of have to go out the window. The top-down, authoritative, more command and control, I'm in charge, that means I know what's going on, and we're going to do this, and let's go get it done. We kind of have to just drop that, right? That level of leadership is appropriate, but that's more like, we've just got a tsunami alert. We need to take control. You have to move, evacuate. You kind of have to have command and control in some scenarios, but that's only usually if there is a true disaster and you have to kind of make some immediate calls very quickly. You don't have time for analysis or analysis paralysis. But for the most part, it's how do you actually engage your partners and work with the people you're serving, whether that's, I said it earlier, whether it's their patients or communities or your workforce or your staff. I think that's where it comes together. You can work with someone, you can supervise someone who's older than you, but in the same wisdom and respect you would bring to someone if you were meeting them in your living room or at your place of worship or in a community event or something. There is some level of respect that's given. And I think as long as you can maintain that, am I respecting this person in the same way that I would respect them if I was standing in front of them and this person is with their family? How does that come across, right? And if this person that you're oftentimes meeting may be a head of a household or maybe an adult. They might have kids. They might have others. It's like, you always want to watch your tone. Would I be talking to a person in this tone in front of their kids who look up to that person as their hero or their, all that? You just got to remember that, because we can convey messages and we can convey things around, what's a better course of action, maybe some tough conversations around accountability and without being disrespectful. If you're grounded in facts and if you're grounded in like, we're only having this conversation because, these things did not get done when we were asked when they get done. So how do we not be here again in the future? Versus, I heard that you did this and that, and I heard you don't like, no. We just gotta kind of get away. So we can do all the other things of being data driven and remembering to be nice people without sacrificing accountability for being nice. I think it's doable. But my hardest parts have been having to have some tough conversations with folks that are older than me. In the civil service county system where I spent essentially my entire career, you have the bumping system, right? A position might get eliminated, so a person who has seniority and tenure in the city might end up bumping into another role somewhere completely different, affecting a person who had nothing to do with what's going on, right? So from Public Works in San Francisco gets, their position gets eliminated, so they bump someone else in the Public Health Department, who just happened to only start 6 months later than that person back in 1980. So you're like, okay,
wow.
And then you're having to tell the person saying, hey, unfortunately, we're gonna have to let you go. Like, wait, what? And it's not performance, it's not anything, it's just because of the civil service rules. And obviously there's other things that you can try to do, get them on other lists of the city to make sure they can get on board, but it's a jarring conversation. And it's even harder when there's no true no, you're doing a great job, it's just the system. And so I've had some of those conversations, and those were hard. Those are the ones where you go, and like, I gotta put my head on the pillow and just I'm gonna go to bed tonight without having dinner. I'm just kind of not feeling in the mood. And so but you get through those and you realize just have a heart and you can get through it.
Wow. I mean, that's extraordinary. I didn't know that. I've always worked in the private sector or the for-profit healthcare and not, but I can imagine having the empathy and the compassion for, again, someone who's 40-year employee compared to 6 months behind someone else. That's extraordinary that, that you had to, navigate that. And it, again, goes back to who you are and sensitivity and awareness and all that. So definitely, it's something that I never had to go in my career. I had almost the opposite. And you also being in some pretty major positions at a fairly young age. I was often called the boy administrator because I was 26 years old and I was a CEO and, did that for 17 years. But one thing I did personally, I kept on my weight. I weighed 100 pounds more than I do now. So people thought I was older. But, I also tried to do the same thing where I was dealing with people who are probably my age now that, you had to have those difficult conversations because it was performance driven. Right. And so, it's definitely a challenge. I'm wondering if you've seen anything, not to pick on any particular generation, but the current, I have 2 millennial kids and also the Generation Z that are coming to the workforce. Are you seeing any different approach of, when I went in and ran hospitals and stuff like that, it was all consuming, work, because it's a 24-hour operation. You work 7 days a week, 24 hours a day, whatever. But I hear anecdotally and other people I talk to like you and others that say, it's a different approach as far as the life-work balance. Any thoughts on that?
Sometimes it's almost like, dang, like the new entrants to the workforce, they definitely are like, I want to come in at this time, I want to leave at that time, I'm not going to be working at night, I'm not going to be working on the weekends, I want to work from home sometime a week. And you kind of hear that and you're like, damn it, that's the life I want, like, shoot, they beat me to it. Like, after that, so it's almost a little bit of like, you're, does it sit is it a little bit unsettling or pebble in your shoe when you hear that? Because it's like, well, that's what we're all aspiring to. That's the kind of schedule when you say you want to work-life balance. That sounds like good. And so I try not to be too visceral in my reaction when I hear this from individuals. But then I think you have to stand that against kind of a juxtaposition of multiple things in the ecosystem. So yes, one could do that once they've built up their own reputation and their rapport and the relationships and those chains of communication in an organization. You can't do that out of the gates. No one knows you. No one. You can't. You can't manage from email. I think that's the technology and the technological advances have proceeded and more recent, like in the last decade, even more rapidly than they did in a couple of decades before that. It makes it easier to send off an email and to work kind of remotely. But the reality is, when I'm sitting in my office now and people can pop in, hey, do you have a minute? That's when the true relationships are being formed, and that's when the true leadership is being demonstrated. I have problems right now.
Yeah.
Can I talk to you for a second? Yeah, I'll drop everything. What's up? In 5 minutes, hey, here's what we're gonna do. That sounds good. Thanks for coming in. And so I think those, in the trenches, in those minutes between the meetings, right, in those conversations between the meetings in the hallways, that's where I think you start to brand yourself as, wow, that person's approachable. Well, that person was really nice. So that person, helped me through it. And I think once you can build that rapport up, sure, it's good to have a work-life balance. You want to try to maintain some level of some mental health. If I can spare a 2-hour commute one day a week by just working from home, great. I personally, when I work from home, I think I have the worst personal hygiene and mental health. I just literally roll out of bed and we'll start working. And it'll be like 7 p.m., 12 hours later, and you're like, I never actually grab lunch. I'm just like, go, go, go. It's almost like having to get up and get ready, put on a suit, get in the car, then got to get back home at some point. Those are good, just reminders that, hey, it's time to end the day, time to start. When you're at home, you're just like, but that's me. And so but I know that even I have to have a balance there. So I do think, Mike, that's with the new workforce, it's a little bit of like coaching around, this is stuff that we want to get to. But when you are joining a team, you really have to get to know your team. You can't. In COVID, when 2020, when everyone's like, oh, what's this coronavirus thing? And you have, I was at Alameda Health System, and you have physicians putting on, they look like Jeremy Renner and Hurt Locker, right? The shield on, a bodysuit, gloves, you name it, they're wearing it. And then when it comes time to clean the room after the visit, here's a mask to an EDS, staff member. And it's like, well, also interestingly, then the EBS staff members are predominantly people of color. And so then you start to add these other layers of, socioeconomic status, the roles, and it's like, okay, well, yeah, if you're wearing all that going to see this patient, and I just get this, and I just might not be with the patient, but they were just in there, you start to have these like contrarian themes. And so I moved my office right down to the EBS basement, and it was just like door wide open. Hey, I'm here. We needed to have the staff, the huddles in the middle of the day, trying to answer whatever questions we had answers to, because everything was all wonky for first half of 2020. At the end, we're just trying to figure out what's going on. But that was a moment of, hey, I'm here. I don't know what's going on either. I can give you some direction, but I knew that if I were to send emails around, please make sure you do this, do that, or the other thing, it wasn't going to go well, right? And those are like the moments you want to you want to try to model leadership. Am I the kind of leader that is the leader that I want for myself, that I want to lead me? And so you just have to kind of step back a little bit. But I think that's part of building back, to wrap up my response to your question. You can, I don't think the new entrants to the workforce are off base about wanting to enjoy the life now versus working towards a 30 or 40-year career and then one day retiring and one day reaping the benefits of retirement. They're just wanting to live their life now, which I endorse that. I support that, but it's got to be with, a workforce like us that are here, and we kind of earned it in a different way. Not to say that you got to perpetuate that cycle of overworking long hours, but you also, they're that paradigm shifting, like, help us help you, and vice versa as we get to this normal, what it should look like.
And Baljeet, I want to also share with our viewers just acknowledging your operational excellence and how you have, over the course of time, driven organizations forward. You also started touching on how you collaborate with the workforce and your community partners when there is an outbreak. And we started touching on COVID-19, the pandemic. We know firsthand that during COVID, you had co-led the citywide pandemic response as the vaccination executive sponsor, helping to achieve well over 80% vaccination rate in San Francisco. But just share with us, what were some of the strategies you have implemented to promote health equity, particularly during COVID and then coming out of COVID? Just share with us the things that you went about promoting
Yeah,
health
absolutely.
equity.
So one of those, it was 2020. I was in Alameda Health System, and so that's when we were kind of setting up all the PPEs and the barriers, and the ability to how do we make sure we're using the correct chemicals to clean the rooms and all that. And then in 2021, right when the vaccine was rolling out, had went back to San Francisco, and so was part of the San Francisco Health Network, which was our full integrated delivery system, including Zuckerberg San Francisco General as the city's level 1 trauma center, country's largest SNF, Laguna Honda Hospital, jail health services, our primary care clinics throughout the city. And the benefit of public health being a team sport, there are a lot of really great people working really hard, had been for the last several months prior to that in San Francisco. And so by the time I joined, one of the end of my first week, it was like, okay, you were going to be the executive sponsor for rolling out the vaccine in San Francisco, as well as separately leading the co-leading the incident command structure for the response that was ongoing, of which was the subset was vaccine rollout. And so the good thing was, we had San Francisco, the individuals, the San Franciscans, are all in, right? They do see themselves as a community and a team, and then we're kind of generally following the rules. When you ask them to do something, they generally say, okay, cool. We also had great partners in San Francisco, Sutter, UCSF, Kaiser, Dignity Health, Department of Public Health, where the San Francisco Health Network was. And really one of the things that we worked to do was, as a safety net health system, which is where I was working, of course, those who, sometimes the system or the healthcare system of last choice, of no choice, underserved, uninsured, those experiencing homelessness, that's the individuals that we serve. Those individuals aren't necessarily going to, as their first order of choice might be to a UC or Kaiser or Sutter or Dignity Health. But those institutions are all great partners and have served these communities, right? San Francisco is only 7 by 7 square miles. It's not a huge sprawling metropolitan area. So it's a small footprint with the volume of a major city in that 49 square miles essentially. And so what we realized is, we all have to, do our part. Yeah, we might be serving folks, and we're not here to recoup. We're not making profits. We're not looking for changing our payer mix. We're not looking for service line or business development or expansions. But we all are at a point now where, when this entire community in San Francisco is successful and we can work to save them, we're all going to be successful. And it all came down to the data. What does it look like? Who, and that's where I think the data intelligence and the business intelligence is so critical for any areas. For us, when we're the equity issues, let's break up our communities right down to the zip code track, right down to where they're in the city, based on the previous census data. What do the folks look like? How do they identify with their either sexual orientation, gender identity? How do they identify culturally? What are their ethnic communities? What are the CDOs? So we really got the data down to be so specific that how do we make sure that we are able to look at that, who's getting vaccinated, who's not, who was able to get access to testing, and who was not. What are we seeing related to individuals in by our age ranges, right? So we were looking at those who were most vulnerable were at an older level, more older in their age, later on in life. And so we just have to let the data speak. Gang, we got to set up a mobile vaccine unit at this corner in this part of the city, because that's where we have the lowest rates. and then partnering with CBOs and others to say, okay, how do we penetrate further in the community? How do we partner with you? How do we partner and leverage your goodwill and rapport with the communities to allow them to trust us? And it got to a point where you're like, well, we're at like a high percentage, and those last, when you're at like 80 or 90%, that last 10% sometimes the hardest to get because they're the ones that are the most like, nope, not going to do it. And really just got to a point where like we knew in some communities, the same 7 to 10 folks were the same ones that weren't getting vaccinated. So I was like, hey, good morning, Baljeet. And any more questions today? Nope. Okay. And it's going to keep on hammering Baljeet to see, if there's anything you need. The other part was just, what COVID showed was that there are a lot of broken bridges in a lot of the communities we serve with health authorities and those who are in theory there to serve these communities. And when you got there, they're like, you've forgotten about us for decades. There are things that we are not happy about. And then you show up and it's almost like a matter of principle and pride. Like, now because you want us to do that, we're not going to do it. And it's like, it's tough to hear. And you step back and you're like, well, that's, I haven't been around for decades, right? I'm at that point, it was like in my late 30s, like, but you are representing an entity, so you take responsibility. And I think the most powerful tool I have is to say, I'm sorry. I think I say it more as I get on in my career than I ever have before. Before it was like a weakness to say I apologize, but now it's like, no, I am sorry, because this is a crappy thing to have happened to you, and I am saying that we want to be better. And so how do we get there? How do we start? And I think that's part of realizing it wasn't just a matter of, are there enough vaccines to give out? It's, are people going to trust us with this? That rumor mill of what's going to happen if you take the vaccine and others. And I think that's one of the bigger things to overcome. Back to your question, Nicole, like, what do we do? How do we navigate it? Good partners sometimes had to have data to show them, to get us over the finish line, to convince them to invest more resources in it, but also then hitting it from the other angle of, it's not always if you build it will they come. Like, if you build it, are you patient enough to wait for them to come and to be there and partner with them? And I think that's one of some of the biggest learnings I've had. So I hopefully we can continue to build bridges in all of our communities moving forward. But it's so if it happens, something like this happens again, it'll be that much easier to ignite and leverage those existing chains of communication.
Well, thank you for that detailed journey. It's definitely inspirational what you've done, being on the ground level and basically being compassionate and working with people during, 100-year epidemic that no one planned in their strategic planning at any health system or any department of health. And it's really, you have to take the action to move forward. So I really appreciate that. I think we're probably pretty much wrapping up here, but I wanted to thank you as a Cal Bear, and it is very lion-hearted that you are in serving others, and your compassion is very inspirational. I can say I'm proud to be a colleague and see the lives that you've probably saved and definitely impacted here in San Francisco and really across the nation in your leadership within the American College of Healthcare Executives. So,
and I echo that, Baljeet. We thank you for your strategic focus on patient-centered care, the data-driven decision-making that you take in each and every day, as well as your community engagement and the workforce development. I think during COVID and coming out of COVID, you have positioned every organization that you've been a part of for continued success. And we sincerely thank you for that. To our viewers, thank you for tuning in. On this show, we share stories, creates a bridge between generations, as you have heard with Baljeet. It allows us to connect on a much deeper level and learn from each other's experiences and foster understanding. Until next time, thanks for listening in, and we will be speaking with you soon. So thanks again.
Thanks, Baljeet. Appreciate it.
Thank you.
Baljeet.